Hello everyone, welcome to this webinar session. On behalf of Delta Tower Ulwe, I am welcoming Dr. Aklesh Tandekar, Consultant, Critical Care Intensivist at Apollo Hospitals, Navi Mumbai.
Hi.
We'll be discussing on identifying asymptomatic COVID patients. So our first question is how to identify COVID symptoms on patients already having breathing disease like asthma, nasal issues and etc.
Hi, I'm Dr. Aklesh Tandekar. As we are all dealing with this COVID pandemic since last 4 to 5 months, and we've seen the numbers rising every day. You see, the numbers have started rising. It is basically because we have started testing more patients. The number of test centers are also more, and we need not panic about have a panicking around us. Basically, most of the patients of COVID infections are found to be asymptomatic. Roughly around 80% of the patients are asymptomatic. Asymptomatic means they don't even have symptoms of cough, fever, or any kind of breathlessness, or any other atypical symptoms of GI manifestations, like some patients have vomiting and loose motions. So these symptoms are not at all present. Some patients of COVID infection may have mild headache or some sort of weakness they may feel, but otherwise asymptomatic patients are 80%. So next 15 to 20% of the patients are those who are symptomatic. But those symptomatic patients are also classified as having mild symptoms, moderate symptoms, or the severe symptoms. These mild symptomatic patients are those who have fever, some have high grade fever, some patients may have cough. The cough is usually a dry one, it doesn't have expectoration, and some patients may even have little breathlessness and all. So but the breathlessness is only on exertion. If they walk or run or so, or do some sort of exercises, then they do have these symptoms. So these patients having fever or mild cough can be treated after consultation with the doctors. So consultation with the doctors is very important, whether it is mild symptom, moderate, or whatever symptoms, or even if you have come across with any suspected COVID patient or confirmed COVID patients, it is very essential that you get consulted by a healthcare worker or a doctor, and then you stratify yourself as to what sort of treatment you require. If you are asymptomatic, the doctors will advise you to stay at home. But if you have mild symptoms, then also you will be categorized. Like if you have mild symptoms, you are not breathless, you will be examined by the doctors on the basis of OPD or on teleconsultations. Okay, you will be assessed by the doctors, and if you don't require any oxygen, it is better that you stay at home. So it is this little more extreme form of mild symptoms, which is called as moderate symptoms, when you have active cough. Okay, you have persistent high grade fever, and you have some sort of breathlessness. These patients are basically screened with RT-PCR, and then even with the mild symptoms, these patients should be screened for with RT-PCR, and patient should be admitted either in the ICU or in the ward. So depending upon the symptoms, and patient who is requiring oxygen, higher oxygen levels are required, and this oxygen levels are dropping below 94%, this patient should get admitted to the ICU. Okay, any patient who is severely breathless and having oxygen requirement beyond certain limits of more than 6 liters or so, or some sort of positive pressure ventilations are also required, these patients should get admitted to the ICU. In the ICU, these patients generally put on oxygen therapy, then fluids are also given, and they are started with some treatment. Okay, so as you know that no definitive treatment is available till now, no definitive antiviral drugs are available, but the currently available drugs are hydroxychloroquine and favipiravir, and which is also called as Faviflu. Okay, and then remdesivir is also available. So these drugs basically they work on reducing the viral load. So how do they reduce the viral load? Basically, hydroxychloroquine prevents the attachment of the virus to the ACE receptor that are located in the lungs. Okay, and that's why the multiple copies are, which are formed, that will be reduced. So the viral multiplication will be under control. Remdesivir also works on, prevention of the multiplication of the copies of the RNA of the virus, and then that is how the viral multiplication, the viral load will come down, and the patient will be, taken care of by its own defense mechanism. If the viral load is increasing, what happens? Our own defense mechanisms, they get activated rapidly. These are like policemen. They consider this virus as a foreign body and then try to kill them. And in the process, what happens? They kill our own natural normal cells also. And when these viruses are broken down into pieces, these pieces again inside our own body defense mechanism, which is called a cytokine storm. The cytokines are the inflammatory mediators which are released in large number, and they try to damage our own organs, like kidneys are affected, the heart also may get affected, even the brain can also get affected. So basically the cytokines cause the hypercoagulable state. The blood becomes thicker and there is a tendency of clot formation. These clot formations can happen in the brain, we call it a stroke. When the clot formation happens in the heart, these patients may present with symptoms of heart attack. Some patients may have rhythm disturbances. Some patients may have a big clot on the pulmonary artery, which is an artery which takes the blood from the right side of the heart to the lungs for the purification, oxygenation of the blood. So if there is a blood clot sitting in the pulmonary artery, it may cause pulmonary embolism, and there the blood supply to the lungs is cut off, and then the oxygenation is compromised. And we have seen patients with ischemic bowels. The bowel blood supply is cut off completely, and then when the blood supply to the bowel is cut off, this bowel gets damaged and it is no more functional. So some patients have even undergone surgery for the removal of the bowel which is damaged because of this clot. And we have seen some patients even having thrombosis in the brain, which is called a stroke, and there are some sinuses in the brain which is called as sagittal sinus thrombosis. So these patients are presented with sagittal sinus thrombosis, and some of these patients also have presented with digital ischemia, some sort of compromised blood supply to the digits of the hands or feet. So these patients are presented with ischemic events of the digits. So this is like a presentation of COVID infection. There are severe form of COVID infections which present in the form of pneumonia or ARDS, acute respiratory distress syndrome. So these are the patients who are severely hypoxemic, and then they're not able to maintain the oxygen levels in the body. Their respiratory efforts are very high, and they at times get fatigued, because when you are breathing fast, you get fatigued and you naturally need a ventilator support. So these are the patients who go on ventilator, and we put them on different ventilator strategies. Sometimes we have to turn them on a prone strategy. There are different drugs also available to improve the ventilator problems. Okay, like giving high oxygen, and some cytokines can also be controlled by newer drugs which is called as tocilizumab. So remdesivir, tocilizumab, these are the newer drugs which are available. And sometimes we have to do a dialysis and remove these cytokines with the help of the filters, which is one of the innovative advanced treatment available for COVID-19 infection. And the vaccine is also in process to come up. Very soon some countries have even started using vaccines, like Russia you must have heard. And then India also, there is a lot of work going on, and in USA there is a lot of work going on. These vaccines are in phase 3 trials. A lot of patients are still to be tested for the efficacy of this vaccine, and very soon the vaccines would be available. So vaccine will improve the immunity. The antibodies will be already present in our body, and then the antibodies will be able to take care of the virus. So we will have to wait for these newer drugs or vaccines to be available soon. Okay, next question.
So, with families being indoors, can the kids be allowed to play with their friends in a restricted or sanitized environment? What precautions can be taken, and what are the chances of COVID infection?
So as we know that the lockdown is still going on, and it is like government also has reinforced everyone, and they have given directives like we all should stay at home as far as possible. If you don't have any emergency work, don't step out. Even offices are following the same guidelines. They are going in numbers like 10% or 20% capacity of manpower is only working. So when everyone is following these norms, and we may have to continue this for some more time. I understand that the kids must be bored at home. They want to go out. They want to play with their other friends and all. So, but at this point of time, it is not recommended that the kids should go out of home. They should interact outside. No, that's not possible, because these are the vulnerable group of populations where the kids and the elder population can acquire infection, and they may develop complications, and then it is very difficult to control the infection in this population. So it is not recommended that they should come out. And basically there are different measures that can be advocated to prevent the kids being little annoyed. They are not happy with staying at home, so they should be engaged in some sort of recreational activity. They should be engaged in some sort of educational activities. They should be engaged like in some social activities at home. We should spend time with the kids. We should show them how they can take the advantage of this lockdown, and how they can play inside only, and they should not go home. Like there are a lot of games are available at home, which we must be playing since ages, and we have stopped because the phones are available. All the games are available on phone, so we have stopped playing inside. So these indoor games, indoor activities should be promoted as far as possible. And then it is very essential to have a healthy atmosphere amongst the family members, because as we know that everyone is frustrated, everyone is anxious, and everyone is a little disturbed, as they are not able to do their routine day-to-day activities. So it is essential to interact with family members, exchange the thought processes. We can actually remember our old days and try to compare with what is going on around, and basically we can read books, we can watch television for knowledge purpose. Okay, it's not like the story or the world is ending. We have to be a little patient. We have to have that positive attitude in our own self, and same positive attitude, some positive thought process should be given to the family members, and that's how we will be able to control these psychological issues. And if we have extreme form of psychological problems, we may better consult with the psychiatrist. Online consultations are very useful at these trying times, and then we should take the advantage and try to get a counseling pertaining to it, because if we are not able to control our own emotions, or we are not able to get rid of these psychological problems, it is better to consult a physician who is trained enough in managing these psychological issues.
So we come to the last question. With rain and resulting virals, how can we differentiate between COVID and common viral, except with asymptomatic cases being on rise?
So as we know that there are other viral infections that are expected in this season, monsoon season. The expected infections could be malaria, dengue, leptospirosis, and other common flu infections are also very common. And then H1N1 infections are also expected to be seen over a period of time. So how do we differentiate? So the differentiation will be on the basis of diagnosis of exclusion. We have to exclude one possibilities and try to differentiate the symptoms of one disease with compare these symptoms of one disease with the other, and that is how we can evaluate. Like a patient with a dengue, they will have a presentation of thrombocytopenia, whereas the incidence of thrombocytopenia is not much with the COVID infection. COVID infections have classical, especially the symptomatic COVID patients will have classical symptoms of fever, high grade fever, cough, dry cough, and then these patients also have breathlessness. So dengue patients will have classical history of fever, okay, which is like high grade fever, but the fever is may not be the fever may not be continuous one, and at the same time they have features of thrombocytopenia. Some patients may present with petechiae, they may have history of mosquito bite and all. So that is how we can differentiate dengue from this infection. And then H1N1 infection is also going to be there. So while we are screening patients for COVID infection, we should send H1N1 also. So in the hospital, it is quite recommended that any patient who has the respiratory symptoms, H1N1 test is also done concomitantly along with the COVID infection. And then leptospirosis and other infections have classical history of jaundice, and basically they have a different presentation. Probably they may not come up with fever, cough, and breathlessness. They may have symptoms of leptospirosis, especially may come up with jaundice. And then common flu, definitely when you don't get anything in your positive results, like the COVID is also negative, your malaria, dengue, lepto is also negative, and H1N1 is also negative, then what remains with you is common flu symptoms. The common flu symptoms are treated like, just need good hydration, good observation, some sort of medicines which will relieve the symptoms of cough or some sort of sneezing. If you have those symptomatic treatment is essential. Probably the antibiotics are also not required, but yes, frequent consultation with the doctors is very essential. None of these infections should be taken like very lightly. So all these symptomatic patients, whether it is viral, non-viral, we should have a consultation, and we should have a teleconsultation, online consultation with the doctors, and get the symptoms sorted out and get it treated appropriately in time. Because in COVID infections, if you're delaying, you may get confused and you keep on waiting, and you're not consulted your doctor, and you come up late, like 10th, 8th day onwards or 10th day onwards, which is a phase of a complication where you have severe hypoxemia. So when you have a multi-organ kind of failure status where you are severely hypoxemic, your oxygen requirements are very high, you are very breathless, and your organs have started getting affected, and if you come up late, then it will be very difficult even for the doctors to treat, because earlier you institute the treatment for COVID, whatever the available drugs we have, and if you get attention in early phase of your infection, your chances of revival will be much better. If you come in a complicated state and you are not consulted the doctors, then it becomes very difficult, and the fatalities are high, all because when you have neglected the symptoms and you have come up late. So it is very essential that we should stay updated. Okay, we should get consulted by appropriate healthcare workers, especially the trained doctors should see you, you should get consulted by online consultation if you are not able to visit the hospital, and get this problem sorted out. This COVID infection is going to be there for long time. We don't know how many months it is going to be there, but these prevention strategies, regular updates, and the advisories from the government that is coming up on day-to-day basis or a week-to-week basis, we should get updated, and then we should not get affected by these fake messages or some fake information that is spread in the media like WhatsApp media or Facebook. We should ascertain the authenticity of these information that you are receiving, and once you are sure that the message that is being read on the media is absolutely like valid, then only you try to circulate. So otherwise circulating fake information to the colleagues, okay, would create unnecessary nuisance, panic, and anxiety amongst own people, and probably they may not take it seriously also. So that's why it is very essential that we should stay updated, stay educated, and stay calm and fearless. We will be able to conquer this COVID 19 infection sooner. May not be like maybe a week or two or so. It may take a long time, maybe 6 months, maybe a year or so. So we should have patience. Till the time, we should stay healthy, stay happy, take care of our own near dear ones, and then we should also believe in positive attitude. We should have that positive belief in ourselves, and I'm very sure that we'll be able to conquer this battle against COVID 19 infection. Till that time, stay healthy, stay happy. Thank you very much.